Well, let's take you back now to East London, where the Treatment Action Campaign is marching to where President Cyril Ramaphosa will lead the World AIDS event. The organization is demanding that all stable people living with HIV urgently start getting a 6-month supply of ARVs. South Africa's national guidelines were revised last year and made 3-month supply of ARVs the new standard for people to collect. They also allow for people to get a 6-month supply, but this is not being implemented. Newzroom Afrika Kema is now joining us live from East London. As you can see, that she's part of those marches. Sipha, once again, a very good morning to you. Tell us about this push to have the 6-month supply of ARVs, and perhaps maybe if the organization knows why some of the health facilities are not pushing for 6 months and instead adhering to the guidelines of just the 3 months.
Well, Aldrin, as you mentioned, that the Treatment Action Campaign is marching to the Sipha Stadium to hand over a memorandum to the Deputy President, Paul Mashatile, on looking at revising the 3-month standard rollout of ARV treatments, but saying that it should be pushed to 6 months. Now, according to TAG, there's about 2 million South Africans that are living with HIV and not accessing, or rather not taking their medications. Also, Aldrin, there's also a huge concern around defaulting people who are defaulting on their ART treatment. And as a result, because of that, it's issues such as waiting line being too long at the clinics or primary healthcare facilities. But now let's bring in the General Secretary, the General Secretary of the Treatment Action Plan, Anele Yawa. Thank you so much, Mr. Yawa, for talking to us on Newsroom today. Let's talk about the change that TAC is asking for, requesting from government, from the 3 months to the 6 months.
So, firstly, the World Health Organization said that all people living with HIV and who are stable on treatment must be given 6-month supply of medicines. And we have seen in other African states, they have started implementing this. The reason for this is because it's all around the adherence of people living with HIV who are on treatment, reducing the number of visits that people make to the health facilities, but also reducing congestion in our clinics. And when people are given 6-month supply of medication, this is what is in the new antiretroviral clinical guidelines issued by the National Department of Health. So today, we are marching to the Deputy President, Paul Mashatile, as the chairperson of the South African National AIDS Council, and Dr. Aaron Motsoaledi as the Minister of Health, to ask them to use powers vested in them to put pressure in provinces, districts and facilities so that these facilities can start giving people living with HIV and who are stable on treatment 6-month supply of their medication, because the problem that we have in South Africa, majority of the public healthcare users have a problem of health system which is failing, where they are subjected to be insulted, to be stigmatized, and all these bad things which they experience in facilities. And as a result of that, many people decide to stop taking treatment. So in order for us as the country to be able to initiate on treatment, the other 2 million which is not yet on treatment, is to ensure that those who are on treatment are stable and we keep them on the program. So that's why today we are marching to the World AIDS Day event to hand over the memorandum, and then after that we're going to sit and listen to the Deputy President and the Minister when they respond to our demands.
So thank you so much, Mr. Yawa. That's Anele Yawa, the General Secretary of the Treatment Action Campaign, the Aldrin, talking about changing those ARV supplies from the initial 3 months to 6 months. Now, of course, some of those that are on treatment have actually been saying, according to some of the surveys that were taken, such as with organizations like TAC, is that they don't have transport money to get to the hospital, to the clinics, to fetch their medication the number of times that they're supposed to. So having the 6-month supply, that would be splitting it to only 2 times a year to go in and fetch your treatment, but also get the necessary checkups that they need, like their blood getting withdrawn, which is something that usually happens every 6 months. So this will also also assist with the congestion, as Mr. Yawa indicated, inside the clinics. where people can access their medication twice a year instead of having to go 4 times a year.